I'm Dr. David Hill, and today we're going to be talking about fever blisters in children. So, what is a fever blister? When we say a fever blister, usually we're talking about a herpes lesion on the mouth. Now, people sometimes get alarmed when we bring up the word herpes. They're like, oh my gosh, it's a sexually transmitted disease. That's horrible. What's been happening? Herpes is an incredibly common infection of human beings overall. Some of it is sexually transmitted, but a lot of it is not sexually transmitted, and almost never in children is herpes a sexually transmitted disease. So you can relax a little bit about that. Now, herpes will start as a red bump or a small blister, usually somewhere around the mouth. It then expands. There may be some others that grow around it. The top will come off. It'll erode. There will eventually be some sort of crust on it, and it will heal up. These blisters can be really tender, very painful. They're quite uncomfortable, especially in toddlers and infants. They can get infections that take over the whole mouth. They can get sores all over the inside of the mouth. That is intensely painful and may even interfere with eating and hydration. That may require care from a doctor to make sure that your baby does not get dehydrated if that's happening. Most cold sores kind of fix themselves, but there is the possibility of treating them with an antiviral medication if you catch them in the first 2 days. What medication is that? Well, there's really about two that we use. One is acyclovir, the other is valacyclovir. As you might imagine, they're related to each other. So if you think your child's getting a bad cold sore, try and get him or her seen in the first couple of days of the infection so that he or she can be treated before it gets too bad. Now, the one thing that people will sometimes confuse for a cold sore is impetigo. That's a bacterial infection. It is not herpes. Impetigo forms a yellow crust. It often occurs in children who have a runny nose, and then they get a little skin irritation. That gets infected, and then it starts to creep down from the nose down to the mouth. Don't mistake that for a cold sore. That probably is going to want antibiotic ointment and an antibiotic oral pill or liquid to try and make that better before it causes facial scarring. So talking about cold sores in children, I'm Dr. David Hill.